As you know by now, priority one on this show is your health, your family's health. But how do you feel? How are your energy levels? They were probably tested a little bit over the weekend thanks to the Kentucky Derby and all the action at the track, the parties, etc. Did you start to feel your age? I know I did. I need 25 again. All right, we're going to talk to Lisa Innenbach here and Kathy Leet as well. Both are registered nurses, so we're getting medical professional advice right here. All right, first of all, how was your Derby?
It was fantastic, despite the rain.
There we go.
I had a good time.
How about you, Kathy?
Same here, same here.
Good for you. I'm glad that you had fun.
Great
You know,
time.
we don't let weather deter us here.
No.
And
We always show up no matter what.
That's exactly right. That's right. Well, there's a reason that you guys can, because 25 again, you're feeling good. Your energy levels are good. And I know that you and your husband, Ted, work hard, play hard. So, you know, those energy, it does pay off, doesn't it? Do you feel a difference? Do you notice some of your friends kind of maybe, I don't know, wavering a little bit in terms of energy? And you guys are like, you're feeling good, right?
Oh, absolutely. I mean, we talk about it all the time, and we get questions all the time when we're out. And how do you guys do that and have such a good time? And your energy levels are always so high. You know, I love what Janelle said. Hormones don't discriminate against anyone. So as you age, your hormone levels will drop. There's absolutely nothing that you can do about it. I don't care if you're eating right, you're exercising right, even if you're the appropriate weight, it doesn't matter. You're going to decrease every year past the age 30. So we usually say if you're 35, you probably need us. If you're 40, you definitely do. Doesn't matter who you are. You're going to decrease up to 7% per year past age 40. You only have about 50% of the testosterone that you had at age 25. Hence 25 again. We like to bring all the hormones back to the optimal levels that you had when you were 25. So you might be confused. Well, I've been to my doctor and he or she says, well, your hormone levels are fine. You're just getting older. When we look at the labs, we say, well, yes, according to this lab sheet, you look normal for your age. I don't want to feel my age. I really say I never really worry about aging because I don't feel like I'm getting older. If I feel like I'm getting older, I'm probably going to worry about that number. But right now, I really don't have to. So these are the things that we're going to sit down with you and talk to you about when you come in. And there's so many more hormones than just testosterone, estrogen, and progesterone as far as men and women go. There's DHEA and thyroid and magnesium and all these different things that we're going to talk about today. And that's why I brought Kathy here to help me with that.
I'm glad you said that, because what we're pointing out here with Kathy Leet again, and Kathy is a registered nurse as well, as is Lisa Innenbach. But what we're going to talk about is how comprehensive the program is at 25 again. As you said, it's not just all about hormones. There are trace minerals. There are other hormones, things that you can take care of yourself, and you guys are all about it. It is about being proactive and preventative, right?
Absolutely. Absolutely. There is, it's really sad because nowadays that people are really being told that they'll go to the physician and the offering is we have drugs and we have surgery. And that is no longer the way that it is. Nowadays we have got to we really have to, prevention is the cure of the future. And we have got to take an approach. But there's so many people that are being misled. There's so much information on the internet. It's really overwhelming to people. And when you have a place to go to and you have an advocate for you at 25 again that's going to look at everything that you need based on what your health is telling us, based on what your labs are telling us, and even your lifestyle. A lot of people we want to run the marathon life. And we do. We want to come home from work. We want to have all this energy. We want to do other activities and charities and other things. And it's sad. We don't want to get to a place in our life where we come home from work and that's all we feel like doing. So we have got to get back to helping people to understand. Again, as Lisa said, there are more hormones than just reproductive hormones. In fact, one of the biggest mistakes that people are making is they're going and getting their reproductive hormones checked based on poor health. And then they're going to apply the medication or the hormones based on the health of their body that day versus total health. And if you're just going to overlook heart disease or diabetes or cancer risk and things of that nature and just apply hormones based on, hey, this is what my body says I need today. You can't do that. You have to look at the labs. You have to get your body in total health. That's why we call it healthy hormone balance, total health. Comprehensive health, looking at everything, including stress.
Interesting, Kathy, because you and I talk about this a lot. And here, I'm not trying to insult the medical community, but a lot of doctors just they just don't have the time. They may have the concern. The great thing about 25 Again is you have both. You have compassionate professionals who are willing to take the time because they realize it's not as simple as some may think. And I think that's important. When we talk about getting a consultation and sitting down and looking at lab work, you're talking about real time here to where you can put, as you say, all the pieces of the puzzle together.
Absolutely. I love the word time because studies show that you have maybe 5 to 7 minutes in the office with your physician, and he or she just really don't have the time. And don't forget, they're really not experts. I mean, we have physicians and nurse practitioners that come to us all the time, and they're not taught the way that we are. We are hormone experts. We're doing it naturally, we're doing it safe, we're doing it bioidentical, which means we're matching molecule for molecule what your body makes so it's not rejecting. Most of the time when you come in and you've got that 5 to 7 minutes, if you're lucky, after you've waited an hour in the waiting room, you're going to be told, oh, you're probably just depressed or whatnot. Well, you don't have Wellbutrin levels in your body. That's nothing that we can test. We know what's inside of your body. We're testing everything, and again, we're getting those back to those optimal levels. We spend an hour with you your very first visit, and then after that, we can spend as much time. Usually everything is 30 minutes, but if you need more, you just ask. You're in control. It is preventative health. You want to live your best healthy life, and what's a better way for me to be a good mom and a good wife and a good friend, and all these things to me are very, very important. And if I'm not healthy on the inside, I'm not helping anybody else around me.
That makes perfect sense. I want to talk about some of these products that are available, and there's a reason that you use this brand. Let's talk a little bit about Integrative Therapeutics. So tell me a little bit about this brand, Kathy, and why is this the one that is chosen by 25 Again?
Well, we are the one brand that chooses to be FDA drug GMP audited. And so if you want to get the same quality and purity, all of the characteristics that would be inspected for pharmaceuticals, then you would actually want your dietary supplements to be that way. We wouldn't want to guess that it didn't absolutely have what was on the label in the bottle. So our clinicians know 100% that every time they use these supplements, they are going to be so well tested above and beyond other brands. We can actually be in hospitals and universities because of our testing. So they know that that patient, would it not be sad if a patient was going to start on a supplement and the company, you know, it was a batch that could have been lesser quality,
right, and
it may not work for them, and then they give up, and that would just, so our clinicians know that therapeutically they're going to apply these products, and they know exactly what's in them, they know the exact dosing, and they know what to expect from them. And based on the person's labs, they can match up what each individual actually needs. People can do harm with dietary supplements. They really can. I mean, it's not going to be like harmful like prescription drugs. It can be very dangerous. But you can actually take one nutrient and deplete another. So, and also, what if you're taking one nutrient and you actually need something else? Because a lot of people will take nutrition based on what they read on the internet, or based on what their next door neighbor used or their friend used, and it just doesn't work that way. And most of the time, if we have patients that are self-readers, self-learners, they come in, we have to change their program because they're not doing the things that they need to do.
Makes perfect sense. And you really articulate that well. Thank you so much. Made it simple for someone like me. Okay, coming up here, we're going to talk about these individual products and what they can do and how they can help you feel 25 again. If you have a question, 5715263. Also, grab a pen because we're going to tell you about how you can take advantage of what's going on now. Feel better now. Let's make a difference. 25 Again by Body Shapes Medical. We'll be right back. More with Lisa and Kathy on Wave 3 Listens Live.